Healthcare, I think, is bringing together a couple of different initiatives that are going to converge at the same time. One is there's an increasing both push and a pull from people in our world to understand their own healthcare process. And so they're wanting better ways, better information to understand their own individual healthcare and well-being status, if you will. Healthcare organizations, healthcare providers are working at it from the other side to provide better tools and information to people at large to better manage their own care processes. I think that's one of the biggest challenges that we have as an industry going forward. And I look out 3 to 5 years, and I look at all the technology pieces that we're enabling in our industry, helping to engage patients in a way that allows them to understand and appreciate their role in the care process by using the tools that we can provide, whether that's social media, whether that's home monitoring tools, whether that's mobile apps, whether that's patient portals or personal health records. All of those things are going to be critical to making a significant difference in the healthcare industry in the future.
Connecting the community is going to be a very important element of the future. The electronic health record, as well as health information exchanges, will enable patients information to flow with them at every point in the community. So the healthcare ecosystem really will become this more connected, information-rich, and knowledge-sharing environment that really is leading us to the future in terms of making sure information is at the point of care wherever the patient is. And so that connected community is making sure that the right information is delivered at the right time to the right place. We worked with a client on a telemedicine project. It was to enable that client could be able to deliver services to a community that really had lacking in certain specialties. And I actually had a family friend that was touched by this. She was able to go to her, she was having symptoms where she was having a loss of speech. Her husband knew that was happening. He took her to the closest hospital as quickly as possible, and that hospital was able, through telemedicine, to be able to connect with stroke specialists at a local university health system. And that particular family friend of mine was able to receive TPA medication, and that prevented her from having severe symptoms of a stroke. And it was just so refreshing to hear that her husband said, you know, this made a difference. Telestroke made a difference to him and to his wife. And I realized that was the power of what we do, that we can actually bring solutions to a community that could never have been able to have that type of outcome. So that made it very real for me, that what we do really can make a difference in patient care.